Hello, everyone. My name is Kathy Aros, and I'm the president of the League of Women Voters of Greater Tucson. Welcome to our League's 8th annual Issues and Eggs event. Today is also our very first all-virtual Issues and Eggs. Thanks to the pandemic, I have the dubious distinction of becoming the first Greater Tucson League president to conduct her entire term on Zoom. Hopefully, I'm both the first and the last. But we did have some positive, groundbreaking things happen in 2020. We saw more people vote in our country than ever before. We now have the first female elected as our vice president. And thanks to our donor support, I'm proud to report that the Greater Tucson League has been on the front lines supporting this high voter turnout. For 101 years, our league has been an all-volunteer, nonpartisan, activist, grassroots organization that has been a leader in empowering voters and defending democracy. Greater Tucson has the distinction of being the largest league in Arizona with over 350 members. 1 year ago, we had to completely change the way we did things, but adapt we did, thanks to the creativity and determination of so many of our members. Over 200 of our leaguers were actively engaged during this challenging year. Voter service, voter education, advocacy. These are the League's 3 main missions, which were so critical during the 2020 election year. I am so proud to report that our League's outreach efforts and projects surpassed the previous year, all while keeping each other safe. Although our League office had closed to the public last March, it continues to operate with a reduced staff of desk volunteers to respond to mail, emails, and phone messages. We lost no time in resuming the first of our voter education programs starting in May. Our unit groups continue to host monthly presentations on topics of interest. All of these programs were open to the public as well as our membership. Our Speakers Bureau gave over 20 speeches on topics such as gerrymandering, redistricting, election integrity, the Electoral College, and the ballot propositions. 7 League-sponsored candidate forums were presented and posted on our website. Voter registration and get out the vote activities prior to the 2020 election were nothing short of monumental and included extensive outreach to Tucson schools and educators, exploring the best way to conduct registration events during a pandemic. Our Greater Tucson voter registration PowerPoint was sent to multiple schools in all the school districts and 3 community college centers, resulting in numerous new voter registrations. Utilizing our education funds, approximately 70 of our members mounted 2 combination postcard and phone banking campaigns, contacting a total of over 11,200 unaffiliated or registered independent voters who had not voted in the previous election. Each mailed postcard sporting a personal message was followed up with a phone call the following week. Yet another group of 16 volunteers assembled packets containing voter registration forms and guides and delivered them to over 170 apartment complexes in Tucson, placing them in laundry rooms or other common areas that residents could access. Our league also funds, along with numerous other publications and guides, our annual Citizens Directory of elected officials. Our latest is hot off the press and has been distributed across Pima County to our libraries and various other groups. And these are just a few of the high points. But today, we are gathering virtually to celebrate Tucson's resilience in the face of this terrible pandemic. This resilience has so many faces: doctors, nurses, other healthcare providers, first responders, grocery store personnel, delivery people, and so many others that kept goods and services flowing and available, all while allowing people like myself and many of you viewing this to shelter safely in our homes. These people are our heroes, and we honor them. The ongoing work of our league is only possible because of generous donations, league memberships, and corporate sponsors of today's program. I would now like to acknowledge and thank our wonderful sponsors. TMC Healthcare, Cox Communications, Pima Council on Aging, Southwest Gas, El Rio Health, HSL Asset Management, Pastiche Modern Eatery, Picor Commercial Real Estate Services, the Thomas R. Brown Family Foundation, Vero Amore, Holualoa Companies, and Tucson Tea Company. We also want to acknowledge a $5,000 matching gift for today's event from Bobby and Don Vandegrift, as well as numerous other individual event sponsors. Thank you all for supporting the mission and continuing work of the Greater Tucson League. And now comes some fun. Those of you who pre-registered were entered to win a door prize, and we are announcing the first two of our 4 winners. Fran McNeely and Tracy Peterson, you have won gift baskets. We will be in touch to get them to you. And now I would like to welcome today's moderator, Jan Lesher, Chief Deputy County Administrator at Pima County. Jan is a past honoree of the Metropolitan Tucson Chamber of Commerce, Woman of the Year. Jan served as Chief of Staff to former Arizona Governor Janet Napolitano, and then as Chief of Staff for Operations at the Department of Homeland Security under Secretary Janet Napolitano. She also happens to be a member of our league. Take it away, Jan.
Thank you so much.
Thank you so much.
And it's so exciting to see you all, I guess, this way. It's hard to believe that last time we were together was the last time we were all really together for quite some time. Who knew that within a week or so, what would happen with the pandemic occurred. But we're excited to talk to you about what will happen after the pandemic. And with that, we have a really incredible group of women today who are going to be chatting with all of you about what's happening and what they've been doing in education and community collaboration, in continuing to provide food and healthcare into this community. And so let me go ahead and start and introduce you to today's panel. We have Lisa Lavallo, the Market Vice President for Cox Communications. Good morning, Lisa. Cio Castillo, who's the Chief Development Officer with the Community Food Bank for Southern Arizona. And Mimi Coomler, who's the Senior Vice President and Chief Operating Officer for TMC Healthcare. Again, three individuals who have been right at the forefront of all we've been doing as a community to deal with the pandemic. We are now going to ask each of the panelists, I'm going to introduce each of them all at once and give you a little bio on each, and then let them go straight to the next and take about 5 minutes and share with you what they've been doing to move education, healthcare, whatever it might be, as we went through the pandemic in the last couple of years. So with that, let me begin and introduce the first individual today, Lisa Lovallo. We all know Lisa as Market Vice President for Cox Communications in Southern Arizona. To know Lisa is to know that she is passionate about Tucson, about education, about children, about the economic growth in our community, and just about every aspect. And she will be talking with you about how Cox has supported kids primarily and all of us as we move from the in-person teaching that we've had in classrooms into all of the virtual learning. After Lisa talks with us, we'll be hearing from Cio Castillo, again, the Chief Development Officer at the Food Bank. If she has not called you and asked for money yet, I bet she will. She has seen the growth of food insecurity, especially during this last year, but has also seen really the incredible resiliency and the kindness and the way this community responds in terms of crisis. And then Cio will turn it over to Mimi Coomler. Mimi, as I mentioned, is the Senior Vice President, Chief Operating Officer at TMC. She served in a variety of different healthcare roles, primarily in Southern Arizona, and really enjoyed what I hear her describe as that personal alignment with Tucson Medical Center's values of compassion, dedication, integrity, and community. And it's, as we all know, how much TMC has been at the forefront of helping us fight this pandemic. And that's because Mimi and her teams have really been on the front lines. So with that, let me turn it over to Lisa, who will kick us off and help us know what her organization's been doing to fight pandemic.
Well, thank you, Jan. And Kathy, thank you and the League for putting this together and keeping us focused on what's important in our community. And Jan, hats off to you and all that you've done. I think you've probably been chained to your desk since last March. So thank you to you and the county and all the folks making things work here. So I've got 3 things that I wanted to cover in my 5 minutes. So I'm going to go kind of quickly because I definitely want to end with some legislation that might be of interest to the League in terms of supporting it or learning more about it. But first, I wanted to talk a little bit about resiliency as it relates to telecommunications infrastructure in our community. So, you know, we have very good networks in Southern Arizona. So I want you to know that we were able to handle the pandemic and the change and shift in habits and practices pretty well. I mean, we're quite agile and we immediately began investing even more money into making sure that we're able to provide Tucsonans in Southern Arizona with what we're going to need in the future in terms of broadband and bandwidth. The only way that that's possible, though, is that we were doing a lot of investment before this happened. And I think that's what you really have to think about when you're talking about these very large scale networks, big infrastructure projects. The cooperation that we've had with the county, with the city, other municipalities to enable us to grow our network and expand our capability over the past decade. Our company has spent about $10 billion doing that nationally, and we have about another $15 billion in the next 5 years to make sure that we have state-of-the-art fiber connectivity to homes and to businesses. So that work's ongoing. We've continued to go forward with that plan, accelerating some things around broadband. But in our community, the thing that's been most interesting is that there are really 3 things that we experienced in this pandemic as far as our customer usage. The first one is, do people have access? Do we still have pockets in our community that don't have access to any broadband whatsoever? And where are those communities and how do we get to them? What's the best way to serve them? What technology? It will be affordable. The second one is, why aren't people in Southern Arizona, why don't they have connectivity in their homes when they have access to it? Why aren't they adopting broadband use at home? That became very apparent because the number of customers that immediately wanted to sign up to get broadband services in their house. They've had access to broadband a long time, but for whatever reason, they didn't connect because they're using their cell phone, because they're using broadband at their place of work. So they really didn't think they needed it at home. And then the last one, of course, in our community, where our average household income is about $50,000, affordability is a major challenge. So do you have access? If you have access, are you using it? And if you're not using it, is it because you can't afford it? And those are the 3, I think, pillars that we had to really address during COVID. So I want to kind of shift over to education, because obviously with the kids schooling from home and all that, that was a major issue for everybody. And so I want to tell you a little bit about what we did there. Immediately, of course, expanded our Connect to Compete program, which is a $10 a month broadband product that you get 50 meg of service, free installation, free modem. We expanded that and made that free for the entire period. The first 6 months of the pandemic, we waived all the fees so that we could get everybody connected who needed to be connected at home so their kids could school from home. And that's been very successful. And what we did was we worked very closely with the superintendents of all the schools. Cox serves about 95% of the schools in Southern Arizona. The only school district that we do not serve is TUSD. But we do work with TUSD to help make sure that their families are connected. We started a program with them this year with the Educational Enrichment Foundation and Raytheon, where we provided $60,000 of technology grants for students so they could connect at no cost to our services. And we also provide that service to teachers. So, you know, I see that I got the 1 minute warning. So that was a really fast 5 minutes. So the rest of the panelists, you better cut your talking points down in half. So let me just skip really quickly to a couple of bills that are in our legislature that will affect our ability to expand broadband in our communities. HB 2596 which is the ADOT broadband bill. We want that to happen so that we can put conduit down the freeway so that we can expand broadband. That's a really important bill that we think is going to pass. The second one is HB 2156, which is a bill that is asking for $10 million to be put against rural broadband expansion. So that's one to keep an eye on. And then at the federal level, the Emergency Broadband Benefit Program, the EBB, right now is it's passed and they're taking comment. And this is basically to provide, kind of like we have 911, providing emergency broadband services to people who really need it. So I would say I'll stop there because I'm getting the stop sign. Again, I'm happy to answer any questions in the chat, or if you want more information, please don't hesitate to reach out and we can talk one-on-one. So with that, I'll pass it back to Jan.
And I will, Seal, you're up. Want to share with us what's going on at the Community Food Bank?
Thanks, everybody. I'm happy to be here and definitely give you an update of what's going on. What we have seen the past year is kind of what Lisa said. It's been phenomenal from our community. It's like we look at it, it's like, how did we get here? You know, when we started in March, you just became agile and you just started doing things because things needed to get done. So one of the things I can tell you is on a national level, our food insecurity has always hovered right around 11 to 12%. That hasn't changed for about 30 years. And then the other thing that we know before the pandemic hit is poverty. There were about 50% of the people who are accessing food have their poverty level, they're within the guidelines of 125%, which if you look at it is not a whole lot of money. So we've had those people already having issues and trying to make it go. And then COVID hit, and then we're like, wow. And then so of course, who does it hit? It hits the most vulnerable. It hits disproportionately people of color. And then we saw a lot of food insecurity. There was a lot of job displacement. So here's something to think about. The first 9 months of the pandemic, we distributed 75 million pounds of food, okay? That's the first 9 months. In a year's time, we distribute 70 million. So we're already above that number. And then on the first 6 months of the pandemic, we served over 200,000 people. And that is what we serve in a year's time. And all relatively speaking, we're a small staff. You're like, how did you guys do it? We have kind of 8 locations. We cover all of Southern Arizona. There is no way we could have done it without community partnerships. So what happened is we, like everybody else, ended up going to a closed facility, and we ended up having to rely on a lot of partnerships. And even what we also knew is that our food safety network was fragile. So we actually had to make some investments in some infrastructures of some other of our food pantries, just because they needed a truck, they needed refrigeration. There is no way we could have continued to serve the community unless we have those partners. And then we also had folks, so we went to a closed facility. When we went to a closed facility, we had no volunteers. Probably 85% of our volunteers are 62 and older. So then you're like, what do you do? So we were fortunate enough that the National Guard did step in. So between the National Guard and then thanks to the county and the city, they were able to lend us labor. They were able to lend us a facility. We served out of Keno. It felt like a year. We started serving out of Keno Sports Center, probably like at the beginning of April, because what we noticed is on our facility and country club, we could not handle that many people coming in. So we went to, and the county was kind enough, they lent us a facility, and we lined up. We were seeing about 1,500 cards every time we were out there. We were there during the summer months, and then, and that trend still continues. We've been fortunate. We were able to move back to our facility, and we're seeing that at that time, we were seeing about 1,500 cards each time. Now we're seeing that about a week. So with the stimulus coming in, we're seeing people alleviate a little, but the need is still there. We're also, there's things, when we got into it, it's like we needed forklifts. We needed, more than forklifts, we needed forklift drivers. So it's like, hi, City of Tucson, can you lend us some employees? Because those are certified positions we just didn't have enough to do. I mean, so we were very fortunate in that, and the community has been totally generous. Sometimes you look back and I'm like, oh, wow. One of the things is we had a company who's like, okay, besides money, what do you need? And I remember telling them, this sounds really silly. This was about in April, May. And we're like, this sounds really silly, but what we really need is actually the sports drink. Do you remember at the beginning of the pandemic, bottled water was gone, toilet paper was gone, everything? Well, guess what? Sports drinks were gone. It's like we needed Gatorade. We needed just simple stuff for the folks that were just helping us get by. So we've been able to serve. We continue to serve. We've never closed our doors. We've never had the need to do alternative plans. But we're agile. We're continuing. We keep looking at the pandemic. We keep looking at what our numbers are, our COVID infection rate, and then seeing how we're going to continue to serve the community. Even though I know we're kind of like looking at vaccines. And we're also looking at how folks are beginning to continue to come into the building. We're looking at probably continuing to serve outside because we're still serving outside. And we're continuing to do this outside work until probably the beginning of November. So with that, I'm going to wrap it up because I got my 1-minute warning already. So, but I want to say, besides being here and happy to be here, I really want to say thank you so much to everyone because I know all of you have supported us one way or another. So we truly appreciate it. So with that, I am going to pass it on to Mimi.
Great, thanks, Tio. And thank you, Lisa, for that warning. For those of you who know me, I can't say anything in 5 minutes, so I'm gonna work really hard to do that this morning. I would echo the kudos or congratulations to the League of Women Voters for your perseverance in this year when nothing was normal, especially politics. And so congratulations on your fantastic work. And thank you for the opportunity to be here with you this morning. I am thrilled that the topic is resiliency. TMC, we have officially declared ourselves on the road to recovery. Over the past year, we have admitted 4,695 COVID patients. And unfortunately, 294 of those we have lost. And what's important to know about those is over 200 of those were lost in December and January. So we had an extraordinarily difficult end to 2020 and difficult beginning of 2021. Unquestionably, the demand of caring for COVID patients and the entire pandemic has traumatized our workforce. At TMC, we have taken specific measures to help them on the road to recovery. We've incorporated things like, I think particularly in the months where the pandemic was the most difficult, we had free food for all of our employees. You could pick up dinner and take it home to your families. We had oil changes. We offered laundry services, some of the things that could help with the burden of sort of general life for our staff. And one of the other issues that we recognized is that our workforce couldn't balance the demands of their job as well as being teachers at home. It led us at TMC to start our own school. We also recognized that the schools faced their own challenges. And so our employees are able to based on the number of days that they work and that the needs of their family can send their kids to school. It's facilitated by teachers, and then they log in to their own school. As a mom of an elementary school child, I participate in this school and can tell you what it has meant for my child's learning, and our employees have echoed that as well. And I think that we're primarily concerned at this point for the long-term implications of the pandemic on the workforce and what the workforce of the future looks like in healthcare. We've heard that the governor has set aside money for childcare subsidies for those going into careers in healthcare. And so that is some potential long-term solutions, but we have opened conversations with local, state, and federal the federal politicians to talk about what we do in the short term to get our workforce back and bolstered. So we would not be talking about resilience if it were not for the work with vaccines. At TMC, we have administered over 80,000 vaccines. 17,000 of those have been healthcare workers. And the other part of that population is largely the over 75 age group on our campus here. And I just want to thank Jan Lesher and the work of the county and the county health department for their support during the pandemic, and absolutely as a part of this work to get our community vaccinated. As of starting tomorrow, we'll be out with the county health department in South Tucson, helping to shore up some of the vaccine disparities that we have all heard about. So I echo what CEO said. I really have appreciated all of the community support. TMC is proud to be a community hospital, and we wouldn't be here and in the place that we are today if it wasn't for the complete support of our community and community partners.
Thank you so much to the panelists. And I've got a couple of questions I'd like to ask to all the panelists, and then maybe some specific questions to each of you. But I think we've been talking a lot about what's happened in the last year. And as we begin, I think, to climb out of where we've been, it's hard to remember that it was a pretty rough start. You know, there was sort of a day where we were all shut and life changed very dramatically in a very short period of time. And now we're coming back out of that. What do you see, would be my question, and I'll go to each of you in a moment, as the real challenge that, from your perspective, that we face as a community in the next 6 to 8 months, maybe a year, as we begin to come back out of the pandemic generally? And then if there's anything the League can, in your opinion, do specifically to answer that and to help with that response, please let us know. And maybe since you are still on screen, let me ask you to respond to that first, please.
You know, I really think as in terms of the work that the League does, understanding, I think that understanding some of the legislation that will come up with respect to, of course, healthcare funding. You know, Lisa talked about how well prepared Cox had been in terms of marching through. And I think it's fair to say that TMC and healthcare across the country was not as prepared for the scale of pandemic. And so I think paying special attention to those legislative issues that relate to healthcare funding so that we are prepared on a larger scale to serve in this type of capacity, and as well as the healthcare workforce. I think it is, we have absolutely had a number of frontline healthcare workers say, this is not the career for me. I can't do this. And so we worry about the long-term health of those who worked during the pandemic. And then, of course, the ability to build our future workforce.
Thank you. Lisa?
I would say that as far as looking forward to the community kind of thawing out from the pandemic, I think it's really important that we are careful about how funds that may come to our community are used to help with our recovery, that we know and as citizens are paying attention to how our public our public officials and leaders are advocating those dollars be deployed. I think Tucson is in a good position for us to benefit from the resources that come in if they're applied in the right ways. To Mimi's point, whether that's to shoring up healthcare infrastructure, to creating more public-private partnerships so that we can expand anything from a telecommunications network or food security in a better, not just a different way, but in a better way. So that, I think, is something that's really important for us to keep our eye on. As far as the League, I mean, I think your advocacy is going to be more important than ever because the community has changed, forever changed. And public policy, often follows those changes. And so I think continuing to be advocates for what's in the best interest of our whole community, trying to, again, keep a nonpartisan approach so that we can keep that rhetoric down so that we are able to find compromise. I think that's really also critical.
Thank you. Sia, what is the next year and look like for you, and what can the league do to help?
So for us, the biggest thing we keep our eyes on is what we call SNAP, which is a supplemental nutritional assistance program, and that's usually tied to a farm bill, and there's always stuff that's in there. That is definitely something that we watch. But one of the biggest things is for us in our community right now is about education, and it's about education on the vaccines. And kind of what Lisa and Mimi also said is really about shoring up those other infrastructures, because that's one of the biggest things that this pandemic really taught us, that our safety structures, at least food-wise, they're not great, so we had to be agile there. But I'm going to go back, and the league can help anything to like really normalize people to getting the vaccine, and the importance of trying to really come up with herd immunity. That's a big thing in order for our community to move forward.
Thank you. See, I'm going to start with a question to you, but I will tell you, one of the things about having the facility at the Keno Sports Complex on Ajo is people really saw, I think, how many people were in need. I mean, I'll tell you, every morning for several weeks, I would get a call from some employee in the county in tears because they were either working in that area or had driven by and saw the impact of the length of the line of people simply waiting to come in and get some food that they had been unable to get because of being out of work or all of the changes that had occurred. So first of all, thank you to the food bank for keep going for that. But where do you get your food? Can you help people understand where the food comes from that you distribute?
No, I'm just kidding.
Yeah,
So we get our food, I know. So we get our food, it is commodity food. It is from the USDA government. And that was really helpful this year in that they actually gave us a lot of protein. So they actually established some bills. There was some, what we call trade mitigation food was part of it. So we saw a lot of protein, we saw a lot of dairy, and those was just wonderful this time around because these were food that was supposed to be bought at the government level that never got bought. So when it didn't, because of what was going on with trade wars with China, a lot of the food banks ended up with that food. We got it for free. We were able to distribute. So we have that. But the bigger portion of our food also comes in from Nogales. We do a lot of sourcing because one of the biggest things that this food bank has made the commitment is to fresh fruits and vegetables. So we get a lot of fruit, we get a lot of vegetables. I mean, people are going home with tomato, with lettuce, with spinach, just a lot of good food and not just soda pops or potato chips or any of that. So, and then the third part of where we get our food is what we call food drives. And that's just people in the community giving us what may be in their cupboards. And those go a lot out through agency. So those kind of the three areas where we get actual food and we buy.
When do you think you're going to be open up again to allow volunteers to come in? And how will we all know when we can come back to work?
Oh, trust me, we'll all know when you can come back to work, let me tell you. So one of the things is we're hoping in our community to potentially have herd immunity by November. So at that point, we're slowly reopening right now. Because of the pandemic, when we did food drive, we have a 30-day hold on our food. And then we're beginning to source our food. So right now we have people who are helping us with distribution until the guard leave, which we're thinking it might be April, even though they've been extended at a federal level. That's where you can help them. They've been extended at a federal level. I don't know what the state, it depends on what the state, and the state has funding to pay their portion of it. If they do, then the guard would stay. If not, the guard leaves by April. And then we are prepared to, besides press releases and social media, and just to do an all call out when we need to. And in the past, when we do an all call out to volunteers, like something's happened that we don't get enough people, the community's been more than generous and has always stepped up.
That's wonderful. Thank you. Lisa, let me turn to you for a few minutes and talk a little bit about what's happening with technology and such. But what, from your perspective, as you've been working with education in a variety of ways, how can we as a community, as individuals, and perhaps as the league, support teachers?
Yeah. Yeah, I think similar to healthcare workers, teachers have really gone through a lot of trauma as well. So, I mean, I think what teachers need, remember, the teacher pay issue is something the league, I'm sure, focuses on. That is a big need. And when teachers can't afford a broadband connection and they're working full time, that's just crazy. And so, we've spent a lot of time, raising money and providing resources so that teachers are provided with free broadband. It'd be nice to see the schools provide teachers with free broadband as part of their compensation. That I think would be something that would be very useful and helpful and a benefit to them for what they're now doing as a hybrid learning environment. I don't think you're ever going to go back to just schooling at the schools. It's always going to be some hybrid approach to education now. And so that's a teaching tool that they need. And I think teachers also need support around professional development, because teachers suddenly, they got to know how to use cameras, they got to know how to use Zoom, they got to know how to use the whiteboards, they got to know how to do breakout rooms. I mean, in the business world, we have people that do that professionally for us. I didn't have to learn how to be a Zoom expert. We have Zoom experts. The teachers they're their own IT person. So we also needed to provide teachers with cameras and other equipment, not just a laptop, for them to be effective. And so, we bought lots of cameras and gave them to TUSD Sunnyside, all the school districts, so they could deploy those. But that's got to be part of the arsenal of education now, is having tech savvy teachers. And so they need the professional development and the resources to do that. And I think the league certainly can help advocate for teacher pay and teacher benefits and those types of things to enable that.
As someone who is in the technology industry, has the community changed forever? What do we see as different? I mean, we're here today on Zoom. We're not in a meeting room. We all have many, many meetings through the day on Zoom. We travel less. What do you, and as a company and you as a person in this community, think are some of these trends that will stay with us in the future, or what's changed forever?
I think one of the silver linings of this is that as the communities start to look towards being smart cities, where they're using technology to do everything from manage water to manage traffic lights to manage all kinds of different municipal services, and how the community responds to smart city technology and understanding the importance of that, they're experiencing that in their own life. So their willingness to support those things with taxes or with fees or whatever are going to improve, and that's going to improve the quality of our life in general in the cities. So I think that's what people are going to reflect on long term as the cities come back and say, hey, we did all this during the pandemic, and now we can continue to do this, and we can add these bells and whistles and this technology and provide this benefit to the community at this fee or at this cost. The society is going to say, we need that. But no, it's never going to go back. I mean, I think that we're now part cyborg. We're cyborgs, right? Part of us do technology, part is human, part technology. That's just how we're going to be, I think, forever.
Okay. Mimi, life at TMC. And again, you mentioned a few moments ago, we're so excited. We've been able as a county to work with TMC to provide some pop-up mobile facilities on the weekends in parts of the community that just wouldn't be getting vaccinated, I think, because of transportation and other issues. So thank you for that. But at the risk of being a little soft about this, what is it, if anything, that gives you hope as you look at where we've been, what you're doing every day? I mean, bless your heart, you're there dealing with people who are ill and are dying, but what is it that gives you hope and makes you get up every morning and decide that we can keep at this?
Thanks, Jan. I am encouraged by and large by the numbers. When I look at what we have to treat COVID patients now with respect to monoclonal antibodies, and I see the effects of vaccination and the effects of compliance with social distancing and masking, the trend allows us to bring visitors back into the hospital. I think that's happening this week here at TMC and has happened last week and this week at other institutions around our community. You know, we're in the business of laying hands on people. And while telehealth has been a great avenue to keep people safe and create access to healthcare for those who couldn't otherwise get what they need, The trend in the numbers gives us the ability to lay hands on people in a different way. I worry about deferred care. It's a question that I ask broadly as I collaborate with different community organizations. And I see a substantial, or hear about a substantial number of cases where people have delayed their care and their symptoms have progressed, and they delay for a variety of reasons. And so what gives me hope is that those barriers that are in our way to connecting and caring for people are going away. And I particularly worry about the intensive care doctors and nurses. And I round in our ICU every day, and I am starting to see that team recover. The first step of that is saying, I'm traumatized. You know, so often you don't recognize you've been traumatized until it happens again. But this team is starting to say, we need some help. And so it's open to dialogue about how we help and how we work together to recover.
Thank you. One last very specific question. People are starting to get vaccinated. Do we have to keep wearing masks?
Yes,
Yes.
We are almost there. We're almost there. I'm certain Dr. Fauci is going to come out and say you could be in a room, but we're not there yet. I think there's more data that is to be revealed about the level of risk. And until we fully understand that, or at least largely understand that, the best way to mitigate that risk is to continue to wear our masks. We have not let up at the hospital at all. And you know, when I'm out in the community, I really see a community that is masked up.
Masked up. Thank you. And thank you. It's been a great panel. If you were sitting in the middle of the DoubleTree, I'm sure you'd see the standing ovation, but I can't thank you all enough. It is good to hear what we've been through, but more exciting for me to hear from all three of our speakers from a different part of the community, how much good there is ahead of us, you know, and what is exciting. So I thank you so much to Lisa, to CEO, and to Mimi for what you did today, for what you're doing every single day throughout the year. I now have the distinct pleasure of announcing the third door prize winner. And I noticed they gave me a name that I will undoubtedly butcher, so I will apologize in advance to Virginia Sumtachi. Is that even close? MMTACCHI, I believe. And if that's you, someone will be in touch from the league to make arrangements for you to, how to get you your wonderful gift basket. So thank you for supporting the league this morning, Virginia. And now I have the wonderful opportunity of introducing our next speaker, Sadie Shaw. This is really exciting for me. For those of you who might have been with us last year, we had a panel talking about the future and what this community could be like. And one of our speakers was a individual who was president of the Sugar Hill Neighborhood Association. And after that panel was approached to run for TUSD School Board, was successful and now sits on that governing body. So when you think of the significant impact in every aspect of the Tucson Unified School District in this community, we now have one of the leaders of that organization who's a league member, part of the diversity, equity, and inclusion work of the league that is so critical and is helping guide policy every single day at TUSD. So Sadie, thank you for what you've been doing. Congratulations, and would love to hear from you on what's new with TUSD in your life.
Thank you so much. Hello, everyone. Good morning. Thank you all for having me, and thank you to the panelists for sharing all of their amazing work. Again, my name is Sadie Shaw. I'm the former president of the Sugar Hill Neighborhood Association. I'm also the recently elected board clerk to TUSD Governing Board. And I'm going to share my story about how I got here. Some of you know this, but many of you don't. I was speaking at the last Issues and Eggs panel, and actually that same morning, right after I left the stage, one of the audience members approached me, Pastor Grady Scott, and he asked if I would be interested in running for TUSD Governing Board. And so, you know, the person who brought me into the league, Kendra Speech, she had told me before I joined that, the league would really help me in many ways. And I really had no idea that like it would bring me to this elected position. So I thank her and I thank the league for helping me get here. Before I really decided to take that plunge, I was very hesitant. I actually talked myself out of it for a good 2 months. And I had a dream that I signed up and I was smiling. And so then I sent an email to Pastor Scott, telling him my intentions to run. And I also, shared that with the DEI committee. And I received just a tremendous amount of support from them. Some of them helped me gather signatures. The League women were some of my greatest financial supporters for my campaign too. And so, yeah, I actually received the most signatures out of any school board candidate in the city, around I think 1,200 actually. And yeah, it was a great journey. Actually, also the league did a candidate forum as well, and I considered that forum to be one of my most successful because I think I felt like I was kind of at home, you know what I mean? And so it was really a beautiful experience. Of course, in the end, I did end up winning. I received about 80,000 votes from around the city, and I was sworn in by the first African-American woman to be elected to the TUSD governing board, Miss Gloria Copeland. And so I had the great honor of being the second only African-American to be elected on the board. And so, yeah, I'm just so grateful and humbled by the opportunity to run and to win and to get to serve my community in this capacity. And yeah, since I've been sworn in and been on the job for a little more than 2 months, it's definitely been a whirlwind with everything going on with COVID and virtual learning. Yeah, so things are happening fast. Of course, there's a lot of controversy in every decision that we make as board members. I've I've gotten kind of used to the stress of the job so far, and getting pushback from people, but also like the flood of support from teachers and staff and parents and community members that really helps to keep me on track and keep me focused and not fall into the depressing parts of being an elected official. Of course, there are those drawbacks of getting hate mail and all of that, but keeping to the work that is positive and how I can make a difference in the community has really helped me and continues to help me as I move forward. As most of you know, TUSD is the largest school district in Tucson. It's the second largest school district in Arizona. And so we do serve a lot of people. We have a little more than 80 schools, more than 40,000 students, and like around 8,000 staff members. And so it's a big job, and I'm learning as I go. Every day there's something new to learn and understand. But I love to hear from people, whether it's students, teachers, parents, or staff. I use their viewpoints and their perspective to kind of lead me in my decision making. And so I know a lot of you have tuned into some of the board meetings that we have. We have them quite often, maybe 2 or 3 a month. Sometimes, we schedule an emergency meeting like we did last Monday about COVID. And so, yeah, it's definitely a roller coaster, but it's something that I'm just so honored to take part in with me and my other board colleagues. And really without the League of Women Voters, I definitely would not be here at all. And so I can't thank the League enough for giving me the opportunity to speak at the last Issues and Eggs panel. Again, for Pastor Grady Scott for reaching out to me and believing in me, and then for my DEI committee for supporting me so much like they did. And so, you know, really looking forward to seeing the continued work of the League and how they can scaffold different community leaders in Tucson to bring them to where I am too. So thank you.
Brenda, we're now going to hear from you.
Thank you, Jan. And I'm Brenda Goldsmith, and I have the pleasure of being a League member and serving with other fellow League members as the program chair this year and the sponsorship chair. So I want to thank all of our speakers today. It's been an amazing morning, and we appreciate you and your insights. And also encourage, this is our time to encourage all of you to become members of this amazing league that we have, our chapter here in Tucson. So you can go to lwvtucson.org and make a contribution or become a league member. Our membership is $75 for the year and $10 for students. So we want to make sure that we have opportunities for both our students. Again, lwvtucson.org. We see now how important, and we've known this, the continued work of democracy, voter registration, encouraging women like Sadie to take public office, supporting them. So there's much work to continue to be done, and this is our major fundraiser for the year. So we want to thank all of you again, lwvtucson.org, or you got this in your, if you pre-registered, you got a lovely bag that came in the mail that had a LWV mask and wonderful Tucson tea in it. So there was also a donation form or a league membership form that you could fill out and submit. So thank you so much. I am going to turn it over to Kathy Aros to wrap us up.
Thank you, Brenda. Thank you much. On behalf of the Greater Tucson League, I really want to thank our speakers, Lisa Lavallo, Cio Castillo, Mimi Coomler, and Sadie Shaw, for sharing their insights today. Your organizations have been major players in seeing Tucson and Pima County through this devastating pandemic. I also want to give a huge thank you to our wonderful moderator, Jan Lesher, who guided us through this last hour. But before we let you all go, we have one last door prize to give away. And the winner is Patricia Heeman. So thanks everyone for attending the 8th annual Issues and Eggs event. We hope to put some actual eggs back on your plate at next year's 2022 Issues and Eggs, when we will see all of you in person once again. Thank you so much. Stay safe out there. And as Mimi said, wear your mask.